I'm Michelle McManus. I'm a Professor of Safeguarding and Violence Prevention. I'm the co-director of the Institute for Children's Futures at Manchester Metropolitan University. My work has mainly been involved in multi-agency safeguarding, but I initially started by looking at how we can make some of the tools that are designed by academics into reality and into practice and make them more operational. And this kind of gathered my passion, I would suppose, around how can we better improve some of the challenges that we have from practitioners in terms of their resources, their demand, the complexity of safeguarding and crime, and ensure that we are designing tools that can be implemented in the reality of these working conditions. So over the last 20 years, a lot of the stuff I've been doing has worked across a range of thematic areas, across partnership working, across various systems and processes, and examines workforce experiences as well as obviously lived experiences of those people that we are trying to safeguard or we're trying to protect from certain harms and also risk manage in terms of their perpetration. And then the whole idea is to bring all that together to improve how we can identify and respond to safeguarding concerns or risk mitigation for those people, particularly within youth justice services and probation. The first one, for anyone who's read a recent paper that we did in 2024 for the Probation Academic Insights, was this idea of moving safeguarding and risk reduction to be seen as everyone's responsibility to a more collective responsibility. Now, what I mean by that is actually it's quite easy to make a decision about a risk, whether that is perpetration or whether that's about harm and safeguarding concern. And then thinking about how I, as a practitioner, can respond to that. So whether that's just a referral, whether that's a risk assessment, but actually that everyone's responsibility needs to move to a collective one to be more effective. And we know that from the various recommendations from serious case reviews, from all of the inspection reports around the importance of that collective, holistic view of that individual and their circumstances. But the reality of that is actually really challenging, and we know that from decades of this research and recommendations. So what we've done is we've created what's called the 12 C's, which is around the collective safeguarding responsibility model. It includes 12 components, and within these 12 components is a real emphasis essentially in the middle of that model, which is around the workforce, so practitioners and agencies. And essentially how the key factors within that are essential, regardless of the systems and processes and structures that sit around the outside of that. Now, the idea of the 12 C's is to evidence any practice, policy, any activity across all of those 12 components to help identify and understand things such as areas of good practice and areas for improvement. And this includes recording which partners contributed to outcomes within the multi-agency arrangements, and then how can we assign very specific actions to ensure that we're moving that forward. And that's where the key thing comes around collective responsibility. So where we know there's optimal working between partners, how can we share that? How can we ensure that others know about this great working relationship? Or where we know there are issues in that connectivity between agencies and information sharing, for example, how can we put something in place to enable us to do that, regardless of the issues around data sharing or systems? And what we've also done around this is we've designed a self-assessment tool, which was co-created with safeguarding practitioners to enable you to be able to record and evaluate and monitor any progress that you're making across those 12 components. The next point I would say is closely linked to that, and that is around this kind of term of professional curiosity, what that actually means in reality, and how do we see the person and their circumstances and context, their everyday life. And that's what we basically mean by professional curiosity. It is far more complex than just putting in an inspection report or a review that we need to be more professionally curious. That doesn't really enable us to move forward. What we actually often see within these reports and recommendations is actually professional curiosity relates to often a lack of child or adult voice, whether this is lacking in actual practice or whether this is lacking in records around this and we can't see that it occurred, although it might have done. Linked to that is the idea of lack of whole family approaches, very similar to the above point, and trying to understand whether this is not being done as part of practice or whether we're just not recording that information. But often we also see professional curiosity looking at kind of lack of awareness and responses to risk factors. In our research that we've seen across all of the criminal justice sector, we see that this sometimes happens when we're looking at chronic risk factors and how they are viewed less so than escalating risk factors to trigger required thresholds, when chronic risk factors such as neglect or certain types of harms can have just as much of an enduring harm on individuals and communities as those that are escalating. The issue of professional curiosity that we've found within our work and something to consider from a practice point of view is that it rarely considers those factors concerning the workforce, whether that's around workforce experience, capacity, confidence, those relationships and connections as well, but also around the systems and processes. And you'll hear me in any of the work that I do talk a lot about systems and processes, how the systems are connected or not so, what guidance exists and the overlapping guidance that we tend to have at local, regional and national level, and how do we navigate through these different policies and guidance to understand what we should be doing, when and how, and who we should be engaging with. And often what we see is actually what needs to happen is a complete refresh of some of that guidance and policy that's available to practitioners who on the ground need to know what to access. This then links into point 3, and it's something that's really kind of raised some profile more recently from the National KC audit findings. And it's this idea of this huge media attention that we get in terms of learning from failure and our inability to move forward from the continuous same recommendations. And our research has shown that even the most robust policy and guidance can often fail in practice. And that is often because our professionals are under-resourced, we're overwhelmed, there's a lack of experience in the new people that are coming through, and we're unprepared a lot of the time to challenge some of that risk-averse decision-making. However, I will challenge here and say much of what makes safeguarding and risk management work isn't captured in these serious case reviews, isn't captured in these headlines or in these inspection reports. And actually what we need to be doing is we need to be capturing and sharing those kind of points of good practice from our probation and youth justice services and our other frontline workers, where they persist, they challenge, they continually ask questions and keep showing up for our children and our adults who actually will push them away. And we need to think about that in our practice. So we hear a lot about what goes wrong, but I would advocate that we need to be louder about what goes right, because we know that everyday practitioners are building these great safety plans and risk management plans. We are forming trusting relationships and preventing harm. And these are often outside of our formal thresholds and roles and responsibilities. So I would say that for workforce confidence in ensuring we're getting the new workforce coming in that are just as enthusiastic as us that have been in it for 20 years, that we need to ensure that we're identifying that effective practice and we're sharing it the same way and the same urgency as we do with these types of failures and these types of inquiries. So my challenge to everyone who's listened to this is about how do you as an individual and organisation share good practice? Is this accessible to people within your organisation? And how is that received by the workforce? Have you got evidence to show that actually sharing that has changed some of the practice within, whether it's your local area or whether that's regionally or nationally? And how can we make that best practice part of what we're doing in our multi-agency safeguarding to promote that good practice work and ensure our investment is in the right places and we continue to improve our safeguarding responses.